Hi everyone, permit me to introduce you to clinical dietetics, a subtopic under diet therapy and hospital practice. My name is Dr. Jumoke Georgina. We will be looking at the overview of diet disease relationship. We will review the basic nutritional principles relevant to disease state, and then we will look at the role played by therapeutic nutrition in modern healthcare. Overview of diet disease relationship. Clinical dietetics is a branch of nutrition science and it focuses on the use of food, diet, nutrition intervention in order to prevent, to manage, and also to treat disease. Clinical dietitians are personnel that work with doctors, nurses, pharmacists, and other healthcare professionals to design therapeutic diet, to monitor nutritional status, and also ensure that dietary intervention support optimal health outcome. In fact, they will all work as healthcare professional or healthcare team. Clinical dietetics is grounded in the understanding that food is not just a source of nourishment. It is also a therapeutic. Diet as a risk factor for disease. When your diet is poor, it can contribute to the development of chronic disease. Cases such as when you have high fat or high cholesterol diet, it can predispose you to atherosclerosis and cardiovascular disease. Where we have excessive sugar intake, it can contribute to obesity, insulin resistance, and type 2 diabetes. Where your diet is low in fiber, it can associate with constipation, the particular disease, and certain cancers. Where also your food is low in fruit and vegetable, it can increase oxidative stress and make you susceptible to chronic disease. Also, where you have consumption of high sodium, can be linked to hypertension and fluid retention. Let's look at diet as a protective factor. When your diet is healthy, it can actually reduces your risk to some diseases. It can provide essential nutrients, antioxidants, and bioactive components. These diets are those that are rich in whole grains, fruits, vegetables, legumes, and lean proteins, and they have been shown to protect against metabolic diseases, cardiovascular disorders, and some cancers. Also, when your food is having an adequate protein intake, it can support immunity. Another example is omega-3 fatty acids, which reduces inflammation. Effect on nutrition. Yes, you agree with me that uh, disease can actually have an effect on your nutrition, and this can be seen during fever or infection, where there is increased metabolism, during gastrointestinal disorder, where you can have malabsorption, during chronic illnesses where you can lose your appetite, or during kidney or liver disease where there is altered nutrient excretion, and during trauma burns and HIV/AIDS conditions where we can have catabolism. Let's also look at diet disease relationship, which can be bi-directional. Diet affect disease risk and outcome, while disease also can influence dietary needs. And clinical dietetics aim to balance this relationship, by supplying nutrients that aid healing while also avoiding some food that can worsen the condition. Review of basic nutritional principles relevant to disease states. Let's take it from macronutrients. Your carbohydrates, you all know that it provides energy, and this is a primary source of energy. And in the case of diseases like or situations like diabetes, the types and amount of carbohydrates influences the blood glucose, and the need for low glycemic index food, fiber, and balanced carbohydrate distribution are very, very critical. For protein, Protein is essential for repair of worn out tissues, for immune function, for enzymes production, and also for maintaining muscle mass. Protein needs may be increased during the period of bone trauma, infection, post-surgery, and it can also be restricted in certain kidney and liver diseases. For fat can provide energy and essential fatty acid. However, the quality of fat really matters. Saturated fat worsen hyperlipidemia, while omega-3 fats reduces inflammation and support cardiovascular and neurological health. Micronutrients they are also very essential, especially for vitamins. Their deficiencies for vitamin A, D, B12, folate can impair immunity, wound healing, blood formation, and neurological functions. For minerals, electrolytes, calcium, iron, zinc, and the likes can play very vital roles in fluid balance, in oxygen transport, in bone health, enzyme activities, and so on. And they must be carefully monitored in period of renal disease, heart failure, and gastrointestinal disorders. Energy balance also require change during illness. Hypermetabolic states that can be seen during the period of fever, sepsis, burns, eh, increases energy needs, while also in conditions such as chronic kidney disease, paralysis may require lower energy intake to prevent weight gain. Let's now look at the role of therapeutic nutrition in modern healthcare. Diet is most times the first line treatment in many conditions. For diabetics, you control the carbohydrates, you know, in order to improve the glycemic control. For hypertension, look at the DASH diet and sodium restriction to lower blood pressure. For renal disease, you look at the protein, potassium, phosphorus, and fluid adjustment to prevent complications. For liver diseases, you modify the protein and energy support to support detoxification and recovery. And for hyperlipidemia, you look at fat modification to reduce the low density lipoprotein cholesterol. And for food allergies, you eliminate diet to prevent allergic reactions. Um, for preventive health care, therapeutic nutrition also play a very vital role in preventing um, in preventive roles rather. And yeah, during nutritional counseling, it helps to reduce issues like obesity, to prevent nutrient deficiency, and also lower chronic disease risk. Another example is in public health strategies whereby you fortify food so that you can prevent widespread deficiency. And these are put into consideration during in therapeutic nutrition. Enhancing treatment outcome is also one of the importance of therapeutic nutrition, and this can speed wound healing, can maintain immune function, can prevent muscle wasting, can reduce the hospital stay, improve quality of life, and reduce medication costs. Another importance is address malnutrition in healthcare. We have seen that therapeutic nutrition can address nutrition screening, oral nutrition supplement, enteral and parenteral feeding, and also individualized care. Education in multidisciplinary care. Clinical dietitians can collaborate with doctors, nurses, pharmacists, therapists to provide holistic care. Nutrition prescription often complement medical treatment, and this, we can say that in managing nutrient drug interaction. Finally, patient-centered dietary counseling is also key because dietary changes require behavioral modification. Therefore, clinical dietitians provide counseling and they use motivational interviewing, cultural sensitive communication, and they also tailor meal plan that fit a patient lifestyle, they believe, and their socioeconomic status so that they can be able to afford these behavioral changes. Yes, everyone, we have come to the end of this class, and next class we'll be looking at this disease or disorder one by one. And first in line is endocrine disorder and nutritional management. Bye for now.